Well, Lucedale is set to officially end fluoridation in its municipal water system next month. The change takes effect May 15th after years of fluoride levels falling below the city's stated optimal range.
J.C. Roberts with the Roy Howard Community Journalism Center explains why city leaders say that they are making the change now and why dental leaders are concerned.
Lucedale is set to become the last city in George County to discontinue fluoride in its water system. State water reports show Lucedale's fluoride levels have stayed below the city's stated optimal range since at least 2020. The report also shows the city recorded 0 months within that range in 2021 and 2022. Mayor Al Jones says the Mississippi Department of Health now requires Lucedale to either restore fluoride to optimal levels or formally discontinue fluoridation.
We're in compliance. We're doing what we're supposed to do. You know, whether you agree with it or not, but we're meeting the health department's guidelines.
Jones says maintaining fluoridation has become too costly and hard on city equipment.
Fluoride is very granular when you put it in, and it wears out the pumps. So one arm was our equipment was in over time it had become failure, and it's very expensive to replace it. And the availability of fluoride, even today, there's very few suppliers out there.
He says replacing the equipment would cost about $30,000, while bulk fluoride now costs more than $10,000. Jones also says the city leaders are concerned about the risk of adding too much fluoride to the water system.
That's a pretty big risk or liability that a lot of water associations don't want to take, because all of a sudden if you got a water manager that messes up and that's too much fluoride going to water, and all of a sudden you can have a whole city that could be suffer in the future.
But Mississippi Dental Association President Charles Belknap says any fluoridation could lead to more tooth decay over time.
If we don't have water fluoridation, we're going to have a very big increase in dental decay, and we already have some shortages of dentistry and hygienists in other areas to be able to take care of that.
Belknap says the impact could be greater for families with limited access to regular dental care.
The most cost effective is through water fluoridation, so we need to be able to equip water supplies to be able to get the supplies that they need, and also the staff, the training, and the equipment to be able to deliver this product to make sure Mississippians are healthy as we can be.
Jones says he understands the concern, but believes residents should be able to choose whether they use fluoride.
We thought it would be better for people to make their own choice, because fluoride is available in many different sources.
The city plans to notify residents through public notices and inserts in upcoming water bills. Reporting for the Roy Howard Community Journalism Center, I'm J.C. Roberts.